Hi, everyone. My name is Sophia Williams-Perez, and I'm a general surgery resident at the Baylor College of Medicine in Houston, Texas. I'm currently completing 2 years of dedicated research at the University of Texas MD Anderson Cancer Center via an NIH T32 funded position. I'm working in the lab of Dr. Elizabeth Grubbs. Before I describe our previous work and our current project, I first and foremost want to extend my most sincere thanks and gratitude to the Thyroid Cancer Survivors Association, also known as ThyCa, for their incredibly generous financial support for this grant opportunity. Our work would not be possible without their support and dedication to both thyroid cancer patients and their caregivers. Additionally, I'd like to thank the American Thyroid Association for their help in facilitating this grant opportunity for both trainees and faculty. During my time at MD Anderson, I've been studying medullary thyroid cancer, and more specifically, a novel online patient decision aid titled mtceducate.org. This tool was developed in collaboration with scientists and clinicians from the University of Texas MD Anderson Cancer Center and the University of California, San Francisco. Importantly, this resource was actually co-created with patients and their caregivers who are affected by MTC. Patient decision aids are tools that help patients and providers make decisions about their care while honoring and respecting the values of the patient. These tools are helpful in the care of cancer patients and even more so in the care of rare cancer populations, particularly because treatment options are limited and less certain, as well as educational resources are scant. We found that MTC Educate was not being adequately utilized by underrepresented populations, especially the Latino and Latina communities. Despite these communities being affected by MTC, their use of the online decision aid was lower when compared to other racial and ethnic populations. Because of this gap, we proposed our project entitled Cultural Adaptation of an Educational Tool in Medullary Thyroid Cancer. Within this project, we have 3 specific aims that we plan to address, which include first, evaluating our current educational aid with a patient design team that includes collaborators from Latino and Latina community health organizations. Second, to test, refine, and produce the culturally adapted educational resource and decision aid prototype. And third, to assess the tool's acceptability with patients and caregivers utilizing peer outreach methods within the underrepresented Latino and Latina communities. Our primary goal is to engage the Latino and Latina MTC community in a patient-centered design process to create patient educational materials that reflect and honor their cultural needs and values. Thank you again to both ThyCa and the American Thyroid Association for this opportunity. I'm immensely grateful for the chance to be able to contribute to the field of thyroid cancer, and I'm excited to share our progress at upcoming ATA meetings.